There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, what is the treatment for young hypertension? Answer by Irene Fwerst. Hypertension, high blood pressure, can occur on its own, essential or primary, or as a consequence of some other condition, secondary. The treatment depends on the cause. Essential hypertension is less common among young people, so it's more likely that an underlying disorder is causing it. But most patients with hypertension have no clear etiology and are classified as having primary hypertension. However, 5% to 10% of these patients may have secondary hypertension, which indicates an underlying and potentially reversible cause. The prevalence and potential etiologies of secondary hypertension vary by age. The most common causes in children are renal parenchymal disease and coarctation of the aorta. In adults 65 years and older, atherosclerotic renal artery stenosis, renal failure, and hypothyroidism are common causes. Secondary hypertension should be considered in the presence of suggestive symptoms and signs, such as severe or resistant hypertension, age of onset younger than 30 years, especially before puberty, malignant or accelerated hypertension, and an acute rise in blood pressure from previously stable readings. Additionally, renovascular hypertension should be considered in patients with an increase in serum creatinine of at least 50% occurring within 1 week of initiating angiotensin-converting enzyme inhibitor or angiotensin receptor blocker therapy, severe hypertension and a unilateral smaller kidney or difference in kidney size greater than 1.5 centimeters, or recurrent flash pulmonary edema. Other underlying causes of secondary hypertension include hyperaldosteronism, obstructive sleep apnea, pheochromocytoma, Cushing's syndrome, thyroid disease, coarctation of the aorta, and use of certain medications. Secondary hypertension, discovering the underlying cause. http://www.apindia.org/pdf/medi. Treatment for essential hypertension usually starts with lifestyle modification and may progress to the use of drugs. The treatment of adults with essential hypertension. Hypertension treatment and management. If you have high blood pressure, ask your physician about treatment. Answer by Michael Gromer. Hypertension in children is treated with lifestyle changes, including weight loss for those who are overweight or obese, a healthy, low-sodium diet, regular physical activity, and avoidance of tobacco and alcohol. Children with symptomatic hypertension, secondary hypertension, target organ damage, diabetes, or persistent hypertension despite non-pharmacologic measures should be treated with antihypertensive medications. Thiazide diuretics, angiotensin-converting enzyme inhibitors, angiotensin II receptor blockers, beta blockers, and calcium channel blockers are safe, effective, and well tolerated in children. Answer by Vasily Skikilius. If a young person, under 35, has hypertension, and that means an average pressure over 10 days greater than 140 systolic or 90 diastolic, that person should be checked out for a cause of the problem. The most common is obesity, but others exist which can be really dangerous. Please speak with a doctor.